Welcome to our series, Understanding Cancer, the Truths, Treatment, and Myths with the John Wentworth Cancer Center, located on East Route 34 in Sandwich. Call the John Wentworth Cancer Center at 815-570-5006. And welcome back, everybody, to our weekly program here on WSPY. Our guest this time around is Dr. Kevin Khater. Dr. Khater, good to have you back. How are you today?
I'm doing very well. Thanks for having me back.
It's our pleasure to have you back here. Today's topic is we're going to talk about the types of cancer that are treated over there at the John Wentworth Cancer Center, correct?
Yeah, we treat, obviously, all types of cancer. I should preface that I don't treat pediatrics thankfully it's very rare. Cancer in kids is extraordinarily rare, but essentially in all adults we treat all types of malignancies.
Okay, and kind of specify what types of cancer, what areas are. We're going to begin with prostate cancer. That's one of the ones that you treat, right?
Yeah, so prostate cancer is one of the more common ones that we treat, just because it's very prevalent, and actually it's a very hot topic now as far as treatment for prostate cancer, because it's become an area of controversy. A lot of people are advocating not even checking a PSA because it's felt that that's resulting in over-treatment of prostate cancer.
Really?
Whereas you have the other extreme, people almost obsessively checking PSA and treating every single prostate cancer that's diagnosed. And so it seems like the discussion is having on these two extremes, of don't check it at all or treat every prostate cancer that's found. And the truth is actually somewhere in the middle.
I just say there's two opposite ends of the spectrum, and you're trying to find something in the middle there that people can agree on if they can. So you do treat prostate cancer over there. One of the other ones that, of course, is one of always concern to a lot of women is breast cancer. Men can get breast cancer too. I think there's a misnomer out there that men can't get breast cancer, but they can, can't they?
Yeah, absolutely. Men can get breast cancer. Typically, it's a genetically linked one, though.
Is it? Okay.
So there's two main genes that drive breast cancer, and so in the male population, if you have that, then you're at risk for developing it. But if you don't have a family history of it, and family history meaning multiple young members within the family developing cancer, then men really don't have to worry about that, and also in the female population don't have to worry about that as well, the genetically linked breast cancer.
Again, the John Wentworth Cancer Center specializes in radiation therapy, correct?
That is correct. So there are three ways of treating cancer. You can cut it out. That's the job of the surgeon. You can give chemotherapy. That's the job of the medical oncologist. And then you can give radiation, and that's my job.
And the third one, type of cancer treated by the John Wentworth Cancer Center is lung cancer. Now, here's something I really thought years ago, my misperception was that lung cancer was you had to cut it out. You couldn't treat it with radiation, but you can, I guess, huh?
Absolutely. So lung cancer is one of the malignancies that I wish the field has made more advances than it did. So it's still a very common cancer. Odds of beating lung cancer are very low, and we haven't made the advances that we have. But in the cancers that are more locally advanced, meaning the lymph nodes in the middle of the chest are involved, or the tumor has invaded the chest wall, then those cannot be cut out surgically, and the best way to treat them is with radiation, along with typically chemotherapy.
Okay. So again, prostate, breast, and lung cancers are types of cancers, again, treated by the John Wentworth Cancer Center. Any final thoughts on this topic today? Anything else?
Yeah, I mean, again, there's a little misnomer that, those are the three common ones, and those are very common, but there are a whole host of other cancers, lymphoma, bladder cancer, colon cancer, rectal cancer, that we need to screen for and pay attention to. Head and neck cancer, the incidences are skyrocketing of head and neck cancer. Esophageal cancer, skyrocketing incidences. So even though those three are the ones we touched upon, we do need to pay attention to the other ones that I've just mentioned. Okay,
real good. If they want to contact you, what's your phone number over there?
We are 815-570-5006.
All right. Dr. Kevin Khater, thanks again for stopping on by and visiting with us, and we'll see you back later on, okay?
Thank you.
Join us next week for our series called Understanding Cancer, the Truths, Treatment, and Myths with the John Wentworth Cancer Center, located on East Route 34 in Sandwich. Call the John Wentworth Cancer Center at 815-570-5006.